Hemmal Kothary, the Chief Medical Officer for Dignity Health Central California Division. Good morning, Doctor. Thanks so much for joining us once again.
Hey, good morning, Alex.
Okay, let's talk about what we're seeing. We saw yesterday, again, the largest spike in Kern County in regards to cases. We saw our biggest jump with 28 cases yesterday. And, of course, you've been saying, we've been hearing from local public health officials as well, that we're going to continue to see a spike as we go on. How close are we to the end of this?
You know, I wish I could say it was right around the corner. Unfortunately, I think we're a few weeks away. That's the predictive models that we've seen. And so I really believe we're several weeks away from hitting our peak.
I want to talk about some current data that we talked about on Tuesday. It's from the University of Washington, and it shows California peaking later this month. We have a graph that I want to show people to better understand what we're looking at here. So again, this is a graph showing the peak, the projected peak for California. And according to the University of Washington, we're going to be peaking on April 28th. So, Dr. Kothary, the good news here is that it looks like California has, for the whole state, has enough beds, total beds. But when it comes to ICU beds, it looks like we're kind of flirting with that line of concern there. According to this, it looks like we have less than 100. We have an excess of 93 beds, ICU beds, for the whole state of California. Is that concerning?
It is. It is extremely concerning. And what we have started to do in Kern County, as well as they have in other counties in the state of California, they started doing something called predictive analytics. What that is we have several people, especially in the Dignity Health system, they're clinical informatics that will come in, they'll take our data, they will analyze it, and they base it on what's going on in New York, and they will tell us county by county, hospital by hospital, how many beds we are short. So we're taking this data and we're taking it all over the Kern County to all the hospitals in Kern County, and we are working together to see if we can solve for that shortage.
I want to talk about social distancing and the importance of social distancing. I know we sound like a broken record here because we keep talking about this, and I know that there are a lot of people who are practicing this, but some startling information from the data company UNA that talked about saying that Kern County got a score, a grade of a D- in how we're practicing social distancing. Why is that concerning for you to hear that? As we, continue to inch closer to the peak of this? Just hearing those statistics is extremely, extremely troubling for me. I just feel that people in Kern County aren't taking this seriously enough. And maybe we're all wrong, but what if we're not? And that's the troubling part. You look at the total deaths globally, and it's, over 48,000. In the United States, it's over 5,000. There is something there. So we have to be accountable to ourselves. We have to make sure we take care of our fellow humans. We have to social distance. That's the one tactic we have that is proven to show the decreased spread of this virus. One thing that I've heard repeatedly from people, I'll admit, people are messaging me and saying this seems like the flu. They keep comparing what's going on right now to the flu and saying that the flu has tens of thousands of deaths across the nation every year, between 30 and 70,000 deaths each year across the nation. You heard from the president yesterday, or a couple days ago, say that there could be up to 200,000 deaths because of this virus here in the U.S. alone. Is there any way that you can compare what we're seeing right now to the flu, even though sometimes you can look at the symptoms and they are similar? Can you still compare these two? Initially, if you would have asked me several months ago, I would have said, yeah, it's no big deal. It's like the flu. The more we learn about this virus, the more we're learning how aggressive this virus can be, how virulent this can be, how the symptoms are so much worse than the flu. We don't typically see a lot of these symptoms. And the symptoms from this virus come on very fast, and they get you very, very sick. So we don't typically see that with the flu. And as we go along, we'll learn even more about this virus. How do you think Kern County is preparing for this? Do you think we've done enough? Do you think we're doing enough and anticipating the worst that could still be several weeks to a month away?
I don't think we can ever become complacent. We have to keep working. We have to keep looking at the data daily. And, I'll tell you specifically for myself, I'm on several calls, several times a day with several different hospitals. So we're working on this, day in and day out. We're not taking any breaks on this. We're not going to become complacent and let this virus overwhelm us.
What we're seeing in New York City is startling. It is concerning. It is morbid. There's no way to sugarcoat this. They are literally bringing in refrigerated trucks as temporary mortuaries to house bodies. That is, of course, on the East Coast. That's in New York City. Do you think that something like that could happen here in the next several weeks? Or is that what we have coming?
I really hope not. What we're seeing, images of on television in New York is just devastating. I really hope it doesn't happen here. We are several weeks behind New York, and so we are preparing. We are learning from what New York has gone through to make sure we are better prepared in the western states, especially in California. Seattle has been hit quite hard as well. We're learning from all these other states that have been hit hard.
One of the things that we've heard from the federal government is that they say that there is not a shortage of tests nationwide. There are plenty of tests out there for people to use. Yet we've heard from numerous people that they have had a difficult time getting tested for this virus. Is there a shortage?
What I think the federal government is doing is allocating these tests to, the areas that have been hit the hardest. Kern County has not been hit that hard quite yet. You see our numbers are increasing daily. So hopefully, we're all in line to get these tests. I would like these tests yesterday. Unfortunately, we don't have these tests quite yet. And I believe if we had enough tests, we could test every single person in the country, and you'd be able to isolate those people and it would be fine. But we just don't have the capacity to be able to do stuff like that.
How are hospitals, I know you were with Dignity Health, but how are hospitals doing right now in preparation for this, since, again, we're just on the upward trend here?
So one of the things we're doing is we're working with all the hospitals in Kern County. Myself is one of the leads on this. I talk to all the chief medical officers in the hospitals here that we have locally, and we're working together. We truly are working together. There is no competition at this point. We're sharing information. We're helping each other out. If new data comes out on certain treatments, we're working together. Our intensivists are working together. So it's a sense of collaboration, and I think you'll see this collaboration sense across the country.
One of the statistics that we received from local public health officials yesterday, since we surpassed that 100 case threshold, was the age range here, and it shows that there are 2 cases in Kern County that are children between the ages of 0 and 17. That's 1.5% of all cases. But then the next age group, which is the largest age range here, is people between the ages of 18 and 49, and there are 59 cases. That is 47% of all cases in Kern County. Is that startling to you?
We had these statistics about a week ago, and I'd mentioned about 40% of the population that was hospitalized was younger population. So, I think that we will see more and more younger people getting sick, and I think primarily because they aren't practicing social distancing. They don't believe that they're vulnerable to this and that they are invincible. And unfortunately, this virus does not discriminate at all.
So it's not necessarily that younger people are just simply testing positive. They're getting sick as well and still in the hospital. So it is affecting them greatly.
It really is.
All right, Dr. Kothary, thanks so much for joining us once again this morning. And he, of course, will join us again tomorrow morning on 17 News at sunrise at the same time. Take care of yourself.
Thank you, sir.
All right.